Thanks very much, and thanks for asking me to talk. Just as we go along, folks, please feel free to interrupt as we go along if you have any questions, or if you want to wait till the end. There'll be time for both. So please just stick up your hand. I've asked Lou to interrupt if there's people online who have questions, and we can do those as we go along. Just to give you some perspective on this particular issue, and I teach in Ontario Veterinary College almost all the time to DVM veterinary students. And when I arrived in Canada, I previously worked for over 10 years in East Africa, saw a lot of ticks. And almost on the very first day I got to Guelph, I asked my predecessor, who was retiring at the time, I said to them, what do you teach vet students about ticks? And literally his response was, you don't need to do that. Ticks are not an issue here. And essentially, as best as I can determine, that was true. It's what's happened subsequently that I think many of us have first-hand experience. I literally got dragged into this issue by owners and vets phoning me up. So what I want to do today are the following things. Number one, make sure you're aware the different ticks that we can find on both dogs and people if you stay in Ontario, and also that you're aware what they transmit to people or pets and what they don't. And one of the ticks is actually a very good tick in that respect. By far, the most important tick-borne disease in Canada and the US is Lyme disease. And so that's going to be the primary focus of what I'm talking about today. I want to give you some information, the ways that the risk of exposure to Lyme disease has been changing over the last 20 years, and how things are likely to change in the coming years. It's very important to appreciate that one of the drivers for the change in distribution of various wildlife species, in addition to various environmental conditions, and we'll cover those as we go along. And I want to finish doing two things. Firstly, give you some tips on what you can do to minimize the risk of you and your pets getting Lyme disease. And then finally, just like vet students, there's going to be a final exam. However, unlike vet students, it's a friendly final exam. And I think unlike vet students, I'm not allowed to pick on you individually and ask you questions. But folks, please feel free to interrupt as we go along. Just wanting to introduce you to the family dog, Gus. Gus is now 3.5 years old. This is actually the first dog our family has had. And I put a picture up of her because getting this dog has completely revolutionized my teaching, because she has forced me to get actively involved in talking about many of the issues we're going to talk about today. She doesn't usually run around with a red bow on her. This picture was taken at a wedding last year, and we were asked to put a bow on her. But it literally, because we go for a walk every weekend in a forest just south of Guelph, and she's off leash for an entire hour, she undergoes basically high risk of exposure to ticks compared to dogs that stay on the leash, particularly outside the environments where the ticks occur. So I'd like to take you to a picture taken of the inner ear of a dog in Guelph. And the first question is there anything abnormal there? So what is it? What's that? It's certainly embedded. What type of parasite is it and why? Everyone agree it's a tick? Okay, why is it a tick? A, you can see it with your eyes, and B, how many pairs of legs? Well, 4 pairs, 8. I have to be careful. Usually I'm rude at that point to vet students. So there's 4 pairs of legs. There's the adult tick. There's 4 pairs of legs, 8 in total. Now, when I came to Canada in 1997, there was essentially only one tick that you found on pets and people here. And a number of people said to me, it really isn't important telling people how to identify the tick because there is only one. But today, there is at least 2 ticks that we find, different types of ticks we find on ourselves and our pets. And it's really important to know which one you're dealing with. Before we get to what you see here, I just want to show you what you will find if you go online, if you look in textbooks and ask the question, what are the ticks that you will find on yourselves or your pets in North America? It's a little frightening. because a table like this appears with at least 8 different ticks. On the left are the common names, and on the right are the scientific names. And that's if you walked around all of North America. But if you stay in Ontario, there essentially are only 2 different ticks you will find on pets and yourselves today. The original tick that was always in Ontario is the American dog tick. Its scientific name is Dermacentor variabilis. And the new tick, particularly in the last 20 years, and that's what I think the focus of today is the deer tick or blackleg tick, scientific name Ixodes scapularis. And those are the 2 you are most likely to see on yourselves or your pets. And I want to make sure you're comfortable identifying them and knowing about the risks associated with them. Just before I go on, I often get asked, are there any other ticks that are likely to come into Ontario? And the answer, well, until a year or 2 ago, it was yes, 1 on that list. And for quite a while, we thought the Lone Star tick is going to be the next tick coming into Ontario. Anyone, any idea where it should be living? It should be in Texas with that name, but over the last few decades, its distribution has spread right up the eastern half of the US. It's in New York State, it's in Maine. And certainly for at least the last 5 years, I said, this is going to be the next tick. But I might be wrong. Because in 2017, a brand new tick for North America was found in New Jersey. It's called the Asian longhorn tick. So you won't be surprised where it came from. What is surprising is that in just the 7 years since it was first detected in New Jersey, it's now in 19 US states. So it might be the next one. But just so that you're aware, if either of those 2 come into Ontario, they are not associated with a risk of Lyme disease. That's specific for a tick we already have. So folks, let's come back to Ontario today. These are the 2 different ticks you will find on yourselves and your pets today. First question, are they fed or unfed? Unfed. And that's very relevant, you'll see later on, to talking about the risk of Lyme disease. The reason I show you pictures of unfed ticks, it's much easier to show you the characteristic features when they're not fed. And just remind me, ticks only feed on blood. And we'll keep coming back to blood as a source of nutrition. So folks, how do you differentiate them? Do they look the same or different? Always when you're looking at ticks, look at this plate or the scutum on the back of the tick. The mouth parts are in front of that, but keep an eye on the plate or scutum and ask yourself, is this all dark brown or multicolored? Is this all dark brown or multicolored? Should we do the one on the left first, the arrows pointing to? Is that plate or scutum multicolored or all dark brown? Folks, you're even better than the vet students. That usually takes 10 minutes. So is everyone comfortable recognizing that plate? That's multicolored. If you see that, that is the American dog tick. Its scientific name is Dermacentor variabilis, and that's the tick we always had. It's a good tick. I'll tell you why in a few minutes. Let's move to the tick on the right. You see the plate on this tick? Is it all dark brown or multicolored? Everyone, it's all dark brown. Does everyone agree? It was a bit of a disagreement initially, but you need to see these things first just to get some appreciation. And I do have some specimens set out at the back for you to look at afterwards. So if the plate is all dark brown, not multicolored, that is the deer tick. That's the new tick that's come into this province since probably the mid-1990s, the deer tick, and that's responsible for transmission of the bacteria that causes Lyme disease. The bacteria is called Borrelia burgdorferi. It's a bacterial infection, and it only occurs in this tick in Eastern Canada. So just to answer a few questions about the bacteria that causes Lyme disease, I said it's called Borrelia burgdorferi. This is a picture under an electron microscope. It's tiny, and it's got this squiggly appearance. And when it infects people or animals, particularly dogs, many dogs never become sick. They don't develop antibody. But if you or I become sick, the disease is called Lyme disease. Any idea why it's called Lyme disease and not Hamilton disease? Anyone know where it gets the name Lyme from? Yes.
Forget which state.
Connecticut. All right. So it's an area called Lyme in Connecticut. If the first time this had been identified was Hamilton, you would be naming it. But I'm afraid, folks, you're about 100 years late. All right. So all the evidence is it's been on the northeastern seaboard of the US for at least the last 100 years, along with the tick. Now, the reality is, folks, typically on yourselves, are you likely to find ticks that are unengorged or engorged, not fed or well fed on yourselves?
I would think.
Usually on ourselves, when we find ticks, they haven't had a chance to feed. Most of us are pretty good at finding them. However, our pets, it's completely different because of their fur. Usually the ticks have been on the animals a lot longer, and the ticks have attached. Remind me, what are they feeding on? Blood. Excellent. And it's the female tick that consumes a lot of blood. So this is actually a tick attached, again, to the skin of a dog in Guelph, so not far from here. You can see now the body is greatly enlarged because she's feeding on blood, all right? And she's feeding on blood to produce her offspring, which are eggs. But what has not changed, don't let the size throw you, the plate or the scutum does not change. So you know the questions that's coming. Is that multicolored or all dark brown? Multicolored. So which tick is it? So that plate tells you it's the American dog tick, Dermacentor variolus. Is my dog going to get Lyme disease? No, absolutely no association with this tick. So this tick is a great tick. One of the obvious questions is, for each of these ticks, where are you likely to get exposed? And the answer for both of them is you must go outdoors into specific environments. And it's all driven by where the different life cycle stages of the tick can remain viable and reproduce and feed. This is a tick that's one of those ticks that's dropped off an animal. So she's well fed. She's dropped off into the environment. And what's she laying into the environment? Yeah, thousands of eggs. If that happens indoors like this, they will all die because there's a certain amount of humidity and, to a lesser extent, temperature that's required for those to mature. And it's particular types of bush that are conducive to those eggs surviving. But once they get into the environment, what then hatches out of that is a tiny little immature tick called a larva. It is tiny, and it usually feeds, this is the American dog tick, it feeds on wild rodents. So you have to have wild rodents in the environment for this tick to establish. What is that larva feeding on when it attaches to a wild rodent? Blood. It's always blood. Once the larva is fully fed, it drops back off into the environment. And again, if that happened indoors, it's not going to survive. But outdoors, it may. It then molts to a nymph. It's a slightly bigger life cycle stage. That tends to feed on larger wildlife species like rabbits or raccoons. Remind me, it's on rabbits and raccoons to feed on blood. Once it's well fed, it drops off into the environment, all right? And then it's looking for other wildlife species after it molts to the immature adult. And again, that's often raccoons, but it is often dogs, cats, or people that we may see the adult tick where they feed on blood, and that's usually, particularly in our pets, we don't find them until they're fully engorged. So for the tick to establish, you have to have those wildlife species outdoors. You have to have the right type of environmental conditions as well. So that's temperature, humidity, and particular types of bush and grass. And I'll explain that in a second. So just to remind you, the larva that hatches out of the eggs typically feed on small rodents. They then molt into nymphs that feed on wildlife species. And it's adults that we typically will see on ourselves or our pets. Yeah, there's a question at the back.
So a dog tick won't attach to a deer?
So a dog tick won't attach to the deer, not if it's read the textbooks. And I'm being a bit farcical. They typically have preferred food sources, but if times get tough, they can sometimes switch their feeding preferences. All right, so this is what typically they do. There's always outliers. I think one of the obvious questions is what type of environment does this tend to establish? Typically open grassy meadows, all right? And walking through grass in such environments is where you're likely to come in contact. This occurs right throughout Eastern Canada, but not everywhere. So it's not everywhere. It's in pockets. And what time of the year are you most likely to see adults? It's this time of the year. And that's very different from the other tick. You'll see in a minute. So it's typically this time of the year into the early summer, and then we no longer see it for the rest of the year. Is this a good or a bad tick? In Canada, it's a really good tick because all the evidence is it doesn't transmit any pathogens to people or our pets. So it's effectively a clean tick. I tell the vet students it's a great tick. They said it's not for the pet owner because one tick is one too many ticks on a dog or cat. But there's no risk of any disease in Canada with this tick. Let me show you another tick. First question, is this tick fed or unfed? Well, so it's very well fed. You know the next question, well, which tick is it? So again, don't let the body throw you. This tick's been feeding on blood. Look at the plate. Is it all dark brown or multicolored? All dark brown. This is the deer tick, Ixodes scapularis. Just a quick question. Who's seen either of these two ticks? Yeah, okay, I'm not surprised. Okay, excellent. This shows you two pictures of uninfed deer ticks. Everyone comfortable recognizing them? These two ticks have not fed. The picture on the right shows a tick that's crawled up to the top of a blade of grass. And can you see its front legs? They're sticking out. It's called questing, which essentially means it's waiting for you or me or our pets to walk past. And if we touch it, it transfers to us. So ticks typically don't hunt people or our pets. We walk into their environment. It's very different if you have fleas in the house. They literally will search you out. So here's a tick. It's questing. It's waiting for you or me to walk past. So practical question, where do you think most ticks are going to attach to you or me as we walk through the bush? Typically the lower half of our legs, all right, up to about 50 centimeters above the ground. Of the two ticks, this is the only tick in Eastern Canada that transmits the bacteria that causes Lyme disease. And it causes disease, as we already heard, both in dogs and in people. But it also transmits, to a lesser extent, another bacterial infection called anaplasma, and that actually infects both people and our pets. It's just a lot less common, but it is in our ticks as well. But the biggest concern is Borrelia burgdorferi, the cause of Lyme disease. Now, the obvious question is, what sort of environment does this tick do best in? It's called the deer tick. Any idea why? Yeah. Because the adult ticks, if they've read the textbooks, and I'll come back to that in a second, typically the adult ticks like feeding on deer for blood, and particularly white-tailed deer. What's the adult tick feeding on blood for? Well, the female's feeding on blood, like the other tick, because she wants to produce eggs. Once the adult tick has fully fed, she then drops off into the environment. And if that's indoors, again, all the eggs are going to die. We don't have the right conditions indoors. There's certain conditions outdoors, particularly bush associated with deciduous forests, seems to be ideal for survival of this particular tick. But the different stages also feed on wildlife species. One practical point, if the mother tick is infected with the bacteria that causes Lyme disease, none of her offspring are infected. So all the eggs an infected tick releases into the environment, all the larvae that hatch out of those eggs, so those down here, none of those are infected. So the obvious question is, well, then how does the larval stage get infected with Borrelia burgdorferi, the bacteria that causes Lyme disease? And it's all driven by what the ticks feed on. Larvae particularly like feeding on wild rodents, especially white-footed mice. What are they feeding on them for? Blood. But the issue is white-footed mice in particular are the permanent reservoirs for the bacteria, Borrelia burgdorferi. It circulates in their blood, typically never makes them sick. But if a tick feeds on a white-footed mouse and ingests blood, with the blood, it ingests the bacteria that causes Lyme disease. And once the tick gets infected, it remains infected for life. But there's something that absolutely maximizes the chance of getting infected, and I'll explain that in a second. So I just said the larvae feed on white-footed mice. They're not concerned with Borrelia burgdorferi. They're after the blood. But once they're fully fed, they drop off into the environment, they molt to the nymph, and the nymph also prefers feeding on white-footed mice. So if the larva didn't get infected the first time because it fed on a mouse that wasn't infected, the larva is feeding on the same species. It's quite unusual that two life cycle stages feed on the same wildlife species, and that maximizes the chance of the tick getting infected. And once it's infected, it remains infected for life and can transmit the infection, all right, when it's feeding subsequently. The nymphs, again, are feeding just for blood. Once they've fed, they drop off into the environment and they molt to immature adult ticks. And it's typically the adult ticks are the only ones we see, partly because of feeding preference and partly because of their size. I'll come back to the role of nymphs in human Lyme disease in a second. Now, you may think from that life cycle that deer are fundamentally important to the Lyme disease life cycle. And that's true. But if you go to a park in New York City, these ticks occur there and there is a risk of Lyme disease and there are no deer. The adult ticks have learned to feed on rats. Now, the risk of Lyme disease is a lot less and the numbers of ticks are a lot less than elsewhere. So when there are no deer, they can change their feeding preference. But typically, when you have deer, that maximizes the chance of the tick establishing and breeding happily. Just to give you some idea of size, this is a human thumb. Sorry, I had to point that out to some vet students. It's the one species we don't teach. But it's to give you some size. That's a larva. Do you think you would see it? No. And typically, it's only ever on wild rodent species. That's a nymph. Do you think you would see it? Let's say maybe. There's a split opinion on that. Just so that you know, more than half of all the human cases of Lyme disease are thought to be associated with the nymph stage, which is why quite often people get infected and have not seen the tick, because it's tiny. What we most commonly see are the adults, either before they've fed or after they've fed. And I've put examples of adult ticks on the back. So just to remind you, larvae primarily are found on wild rodents, particularly white-footed mice. Nymphs, same species they prefer to feed on, but there's another species that's extremely important as a food source. Starts with B and ends in S. Birds. And it's extremely important to appreciate that both larvae and nymphs will feed on birds. And when they feed on them, they remain attached, typically for many days. So if a bird takes off after a tick has attached, literally that tick has got a free flight. And at this time of the year, where are a lot of birds migrating into southern Ontario from? The US, particularly the northeastern US, and we'll come back to the significance of the northeastern US in a bit. Adult ticks, as I said, primarily are found on white-tailed deer. And notice it's both nymphs and adults that will feed on people. Where do these ticks do best? As I said earlier on, it's typically bush associated with deciduous forests or within deciduous forests. Just to give you some examples of typical ideal habitats, here's a deciduous forest. You can see there's a path walking through there. If you stay in the middle of that path, are you going to get exposed to the ticks? No. They're crawling up blades of grass, waiting for you and I to walk past them. But if you wander off into the grass, then immediately you and I are walking into their environment. Now, how much of the year? Yeah, there's a question in the back.
I noticed, and it's just all the fact, but the ones that they like to feed on. I noticed that you had dogs for both, but the American dog, American tick, whatever, the dog tick, fed on cats and dogs, but the deer one doesn't like cats.
So the question is which of these two ticks will you find on dogs and cats? You'll find both if your cat goes outside into their environments. Usually, you're much less likely to find ticks on cats than dogs that go outdoors. Why? Why? Why, if you have an outdoor cat, typically you're much less likely to find a tick on it than a dog?
They clean them.
Yeah, they're much better at grooming themselves and pulling ticks off. So I apologize, I didn't put all the species on that you'll find them. Yes, at the back.
So what if they have a dog eat some infected mouse?
So if an infected, can I do cats first? Okay, so the answer is I don't know because not many people have done the study. However, it's a very reasonable question. Cats, certainly get fed on by deer ticks and certainly develop antibody to the bacteria that causes Lyme disease. There's no evidence that cats get Lyme disease as in become sick. For reasons we don't understand, they're very resistant to development of disease. Dogs, I don't know the answer. I wouldn't be surprised if it could happen. All right. Most dogs, if they get infected, never become sick. Only about 5 to 10% of dogs that get infected with Borrelia burgdorferi actually become sick. People are completely different. Most people that get infected become sick. So don't eat wild rodents. Because I don't know the answer, but it's a very reasonable question. And the one species you should not be eating wild rodents is people for various reasons. Sorry, I hope that wasn't too flippant. I think the obvious question is, at what time of the year are you most likely, particularly to find adult ticks on yourself or your pets? These are data from Public Health Ontario for 2018. This is for Ontario. And the green bars indicate the number of submissions, number of ticks they received in every month of the year, right? And there are actually two peaks. And these essentially will be ticks off people, but it's the same for dogs. You can see they start appearing usually by March. They then peak in numbers this month. And then the adults typically disappear by the middle of the summer. And then they reappear in the fall, typically peaking in numbers in October. How does that compare with the American dog tick? So for the deer ticks, we see them in the spring and in the fall. The American dog tick, we said we only see it this time of the year. So at this time of the year, if you see a tick on yourself or your pet, it's going to be either one of the two that we've mentioned. In the fall, there's a 99.5% certainty, there's always exceptions, that in the fall, it's going to be the deer tick. I think the obvious question, why two peaks? The ticks that we see in the fall are the newly emerged adult ticks, all right? And typically, they've started feeding. And if they don't feed, they survive the winter under the snow. And what we see at this time of the year are all the adults that survive the winter under the snow and are looking to eat. What's important to appreciate in the summer months is when the nymphs are in the environment, and that's relevant, very relevant for human Lyme disease risk, all right? So the nymphs typically only occur in the summer. They're not on this bar graph because most people don't see them. I'll come back to the significance of that in a few minutes. So, obvious question. So what influences the risk of exposure to the tick and the bug that causes Lyme disease? It's entirely driven by where the tick lives and what you and I do in our spare time. Do we go into their environment? Are they in our neighboring environment? Let me show you what's happened since I moved to Canada in the mid-1990s. Up until the mid-1990s, the only place in all of Canada where the deer tick is thought to have existed is shown by the red arrow, and that's Long Point on Lake Erie. That was it. Everything that's happened since, all right, has been associated with the change in the distribution. So till the mid-1990s, that was the only place. In the years following that, I got phone calls from vets. Physicians started seeing people with this tick on them in other parts of Canada. And so the Public Health Agency of Canada got extremely concerned and started a national surveillance program. And this is their 2008 map for all of Canada, where every red dot indicates where a deer tick was found. So you can see it's no longer just Long Point in Lake Erie. Where is it? Well, you can see there's a lot of dots, southern Manitoba, throughout southern Ontario, southern Quebec, and the maritime provinces. Now, it's very important to appreciate the first time you see this tick in your environment, so that it's never been reported, you always must ask the question, are these what we call adventitious ticks, which means ticks that have dropped off, particularly migrating birds, or is it an established actively breeding population? Why that's important is because if they're adventitious ticks that have recently dropped off, they probably are not going to survive. And the risk of Lyme disease associated with them is typically very low. What is a concern is if they have established. And once they're established in breeding, as the years go by, more and more of the ticks in that area get infected with the bug that causes Lyme disease. Let me just drive that home. That's the map for 2008. I'm pointing to 3 tick submissions from Alberta. To the present day, there is no evidence that Ixodes scapularis has established in Alberta. To prove that, what is typically done, so if you reported this tick to your public health unit, and that's the first time they've heard about it, they will send someone out into the same environment that you were at. They literally drag cloth along the ground, dragging for ticks. And if they find it, they'll go back the next year. And if they find it 2 years in a row, that's the definition of an established tick population. Just so you know, all the evidence is the tick is probably within the next year or so going to establish in Alberta because their humidity has been increasing significantly with climate change. They've always been a much drier province, for instance, than Ontario. So I think coming back to Ontario, the obvious question then is, okay, where are the endemic, the actively breeding ticks? And certainly for the last 10 years, every year Public Health Ontario has been publishing a map on their website. I put a handout on the back that is the map for this year that literally got published 2 weeks ago. What I want to take you through is from 2017 to the current day, because things have been changing quickly. Just to remind you, that's where the tick always was. And I want us to focus on this area in southern Ontario because that's where we're located. That's Hamilton, just there. Just note, that was the only place until the mid-1990s. And then soon after, the tick established Point Pelee, Rondo, Turkey Point. Why was it the national parks on the northern shore of Lake Erie and Lake Ontario, which were the first places this tick established? What's that? So A, it's an ideal habitat, but B, it's all to do with birds. Can you help us? Bird, when you migrate. If you migrate northwest across the Great Lakes and you're looking for the nearest equivalent of a Tim Hortons for birds, the most ideal places would be these provincial parks. And so they land and drop off those ticks. Now, I know you're going to come back to me and say, but birds have always migrated. The numbers haven't really changed, perhaps, but what has changed are the number of ticks in the northeastern US. And so more and more ticks have been coming with migration every spring, and eventually they started establishing. But this is 2007. The yellow areas indicate where there's evidence the tick is actively established. You can see that in 2017, most of the yellow is in Eastern Ontario. There was nothing in Hamilton on this map. These maps are always a year or two out of date because they need people to go out and drag for 2 years. I'm going to take you forward in 2-year increments. Are you ready? So this is, no, okay. Okay, so just watch Hamilton, taking you through 2019. So you can see, look what's happened. So that's 2017, 2019. There's now evidence it's established right around the western end of Lake Ontario. All right, this area has increased slightly. And you may have noticed the appearance of these two boxes. These just indicate that there have also been changes in the northern parts of Ontario, on the border with Manitoba. So for instance, Kenora, Rainy River, and also in the Thunder Bay area. That's 2019. Let me take you through to 2021. There's not much of a change here, but there wasn't much going on in 2021 because of COVID. The ticks didn't sit back and wait. They just kept on with life as usual, but the surveillance wasn't going on that much. But there was clearly evidence in that year they found it for the first time in the London area. Going through to 2023, this area has now expanded. There's another hotspot here, and this is now filled up right to the southern shore of Georgian Bay. 2024, this is now actually complete. So it's literally right around the entire shore of Lake Ontario. Let me take you back just 7 years, 2017, 2024. That's an extraordinary change in just 7 years. Why? What are the drivers for this? Well, I told you things have been changing dramatically in the US. I want to show you in this map, the blue dots indicate all the human cases of Lyme disease in 2001. Where is most of the blue? The northeastern US, particularly states adjacent to Connecticut. There are a good number of dots just to the west of the Great Lakes. Keep an eye on this area, and I'm going to take you forward to 2019. 2001, 2019. If you look at this area, 2001, 2019. Somewhere between 80 and 90% of all the human diseases, Lyme disease cases, are in this region. But you can see the distribution has changed dramatically. Now, it's probably in part because there was more surveillance, but that doesn't explain everything. And the numbers of these ticks in this region have changed significantly as well. So there's a lot more ticks and a lot more infected ticks, particularly in these two regions. So why is it changing? Bird migration. As I said, that's always been occurring, but there's more and more ticks been coming in with birds. Part of the drivers in some areas are changes in the deer population. And one of the drivers for that, ironically, is reforestation. The more, sorry if I'm going to ruin everything for you. Like every time we interfere with nature, there's unexpected consequences. And I think initially we thought it's great there's more deer around. But actually, it was great for the tick as well. So reforestation has played a role. And it's very clear that climate change is one of the big drivers for this. Let me show you how. And I'm warning you, this is a little bit scary. Back at the beginning of the 2000s, the Public Health Agency did a study to model the impact of climate change. And this is a pretty conservative estimate how climate is going to change. And that's temperature and humidity, how the ideal temperature and humidity is going to change from 2000 to 2080. And on these maps, just focus on the red, because the red shows you the only places which predicted perfect environmental suitability, and that's temperature and humidity. It doesn't tell you whether or not the rest of the environment is suitable, just whether the temperature and humidity is perfect. Do you see much red on this map? No, just a few dots, but let me take you through to 2020. That's 4 years ago now. And if you look at this distribution, it's uncannily similar to the yellow maps I've just shown you. Would you like to go forward in years? Neither would I, but we have to. This is 2050. This is 2080. All the predictions for climate change in North America predict that the biggest changes in climate are going to be in the central parts of North America and not the coastal areas. Now, that does not mean that by 2080, this tick is going to be over all of that area, because, for instance, if there's a parking lot, the tick is not going to establish in a parking lot. But if everything else is right, I think it's a pretty good indication of how things are going to change. And to date, these predictions have been pretty accurate. So I think the obvious question is, to what extent is the risk of Lyme disease changing in Ontario, in addition to changes in the distribution of the tick? Because the other thing to appreciate is the proportion of infected ticks is changing. These are data from Public Health Ontario, the Public Health Agency of Canada for Ontario, from just 2007 to 2013. That's just a 6-year period. And it indicates the proportion of all the ticks they received that tested positive for the bacteria that causes Lyme disease, Borrelia burgdorferi. Back in 2007, it was 7.5% of the ticks. So more than 90% of the ticks were clean. They were not infected. But within 6 years, almost 20% of those ticks were infected. And the bottom line is, when it first establishes, and in Hamilton, it was roughly 2019. At that point, just a few percent of the ticks typically will be infected. And as the years go by, more and more ticks get infected. All right, so be aware of that. If you've had the tick for a long time, infection in your ticks is typically much more common than a new area. Just to give you some ballpark figures to work with. So overall in Ontario, just under 20% of the ticks were infected. However, if you went to Kingston in Eastern Ontario, about a third of the ticks were infected. That was in 2019. Shouldn't surprise you. They've had it for longer than you, probably at least another 5 to 10 years. Murphy's Point Provincial Park, do you know where that is? So it's halfway between Kingston and Ottawa. For some reason, and it's not clear why, the environment there is almost perfect. And after only a few years, 80% of the ticks there are infected. Long Point, Lake Erie, which has had it longer than the rest of us, all right, but it's not got up to that very high figure. But on average, 2/3 of the ticks on Long Point, Lake Erie infected. So I'm sorry, folks, if you go birding in Long Point and you find 3 ticks on you, it's very likely 2 of them are infected. Now, hang on, there's a few other things that have to happen before you get Lyme disease. And I'll come back to that in a minute. What's the evidence that the risk of infection in people actually is changing? Like, how are the number of human cases changing over time? Fortunately, the province has made this legally reportable, as in physicians have to report it. And I'll come back to when in a second. I think it's important first to appreciate what Lyme disease typically looks like in people. What it typically looks like after a tick is fed, can you see this large round rash on the skin of this person? All right. It's sometimes referred to as a bullseye rash, which is a little misleading because that name implies there's a lighter color in the middle, which is essentially true on that. Most people, you don't see the bullseye lesion, but you have this large red rash. And that typically develops somewhere between 7 and 14 days after the tick has started feeding on you. So folks, this is nothing like your average bug bite. If you're anything like me, for instance, in mosquitoes, within minutes, I'll get a red lesion that will appear in my skin, like really quickly. And within a few days, that's gone. And it's typically no bigger than 0.5 centimeter, maybe 1 centimeter in diameter, period. This is completely different. It takes longer to appear and it's much larger, and it represents where the bacteria is initially multiplying in the skin. And that happens not in everyone, but in about somewhere between 60 and 80% of people. If you have a dog, we don't see this in dogs. It's very much a people-specific issue. So as I said, it develops typically 1 to 2 weeks after the infected tick is fed. After that, usually the bacteria spreads to the local muscle and joints, and people complain that their joints or muscles are aching. In the first month, it's often associated with clinical signs like flu. And I'll come back to the significance of that in a minute as far as timing in the year, because that's very relevant and an easy way to differentiate it typically from flu. After a month or so, if you have not been treated, sometimes the infections can spread around the body and can cause very serious, potentially life-threatening disease months or years later. All right? And that's usually because of involvement with the heart or the central nervous system. It's not common, but it does occur. The important thing to appreciate in the first few weeks of infection, it's extremely easy typically to treat these infections, both in people and our pets. They respond very quickly to an antibiotic. As I said, and it was about in 2015, this became a legally reportable disease in Ontario. And I thought you'd be interested to know when you will be reported, or a friend of yours. If you go into a physician and there's any concern about Lyme disease, you should be looking at that map with your physician. You should always be looking at that map to indicate whether or not you live or visited a risk area. There are 3 definitions legally of Lyme disease. Number 1, you've gone to the clinician who's confirmed you have this large red rash. It's sometimes referred to as erythema migrans. It's greater than 5 centimeters in diameter. And you have a history of either living in or visiting one of these yellow risk areas. And that's Hamilton today. But it depends where else you go as well. So that's one definition that has to be reported legally by physicians. Number 2, if you go to the physician with clinical signs consistent with Lyme disease, and they take a sample from you and the lab shows the bacteria is present, that must be reported as a case of Lyme disease. And the last legal definition is you go to a physician with clinical signs consistent with Lyme disease. This time, typically, they take a blood sample and they show you've got antibody to the bacteria that causes Lyme disease, all right? And you have a history of living in or visiting a risk area. Now, I know some of you are laughing already because I just said, but things are changing really quickly. So this doesn't pick up new areas. Because the first and the third is, have you visited one of the yellow areas? Well, I never went anywhere near any of the yellow areas. Which is what is good. There are additional definitions called probable cases. And that's the first and the third one with no history of living in or visiting a risk area. And I like this because it's trying to keep up with the way things are changing. All right? How many cases have been reported every year in Ontario, starting in 2013, going through every year to 2022? And I've got this off the Public Health Ontario website. I can't get more recent data. That's probably because they're just trying to confirm and validate the last 2 years. But you can see back in 2013, this is the number of human cases reported. There was about 300. And then you can see it's been progressively increasing to about somewhere between 1,400 and 1,500 cases a year. Do you think that's all of them? Totally agree. It's dependent on a number of things. Number 1, do you go to your physician? Number 2, does your physician recognize it? And number 3, do they report it? So this is going to be an underestimate, but even so, you can see cases have been increasing significantly. I don't have the geographic information, but what I do have, which is really interesting, is the number of cases diagnosed each year. And it's typically very similar. These are the data for 2007. Each bar graph indicates the number of human cases diagnosed each month from January through to December. When are most of the human cases being diagnosed? Slap bang in the middle of the summer, in July. That's when most cases are being diagnosed. Help me, how long after infection is it, do you think, before most people go to their physician and get diagnosed with Lyme disease? Probably the first month. And most people will go in either the first day because they just pull the tick off, or the red rash appears on their skin. So most people will have got infected the month before. So the bottom line is most human cases are acquired May, June. We don't get diagnosed typically to June, July. So this is the time of the year when most people get infected, because most people get diagnosed by about July. And the significance of that is once you get to about June, you no longer see the adult ticks. You see nymphs during the summer months. I tell you, they're so small. The reality is most of them we don't see, but you see the skin lesion. So if you develop a large skin lesion, don't hesitate because you can't find the tick. Go into the physician. I've given you the most recent map and hand them the map if they're not thinking Lyme disease. The other issue is, remember what I told you after the skin lesion, what do people typically present clinical signs like? Flu. What time of the year do you and I usually get flu? The fall or the winter, not in the middle of the summer. So if you have a skin lesion or flu-like signs in the middle of the summer, go to your physician and hold the map up. All right, and hopefully that helps. So before we get to the final exam, all right, I'm going to be asking you, will my dog or you get Lyme disease if you pull this tick off yourself or your dog? First question, is it the right tick? Everyone comfortable saying this is the deer tick? Why? Plates all dark brown, so it is the right tick. Is every tick infected? No, but the longer you've had it, the more likely it is. And the other really important question to ask is the tick well fed? Oh, yes. This is one of the happiest, most well-fed ticks I've seen. And folks, that's a really, really relevant question. And it actually was driven home to me last Friday when one of my colleagues literally ran into my office at work with one of these pulled off her husband that morning. It was attached, but it had barely fed. And the significance of that is, this down the bottom here shows you the number of hours after they've attached before they can transmit the bug that causes Lyme disease, all right? And it's not till at least 36 hours after they've started feeding can transmission occur. So if the tick has not fed or it's only just started feeding, there's no risk, even if the tick's infected. But the tick I just showed you has certainly been feeding that long. And the practical significance of this 36-hour issue is, if you check yourself and your pets every 24 hours for ticks, to do a tick check every 24 hours, you will find ticks and remove them before any Borrelia has been transmitted into you or your pet. Yeah, at the back.
That's still true even if you remove the tick, really?
Is that true even if you, sorry, just explain.
Say you leave the head.
Oh, so the question is, what happens if you don't remove the entire head? All right. All the evidence is that transmission essentially doesn't occur after that. Right? Once it's dead, transmission is not going to occur, essentially. All right. Just remember, on average, 1/5 of all the ticks are infected. I suspect the figure's higher than that in the Hamilton area today. So, a few practical tips how to minimize the risk of Lyme disease. Can we start first with dogs? Because it's so much easier with dogs. Go to your vet. The first thing you need to talk about is giving a tick product to your dog or cat. And remember, they're only at risk of this tick if they go outdoors. So if this is an indoor-only cat, you don't need to worry. But vets have a lot of good tick products that last for at least a month and can be applied either on the skin or given orally. And talk to your vet about what's an appropriate duration of the year that you should be using tick control. We typically advise at least 9 months, potentially not the months through the winter. Number 2, dogs have Lyme vaccines. People don't. However, there's potentially good news on the horizon. There are a number of Lyme vaccines for dogs. They're not perfect, but some people do recommend them in addition to using a tick control product. I regularly get asked, well, can we not give the dog vaccines or the tick products to our kids? The answer is no. All right, please, no. But what's most important, whether or not you're using these products, every day, check your pet for ticks. We do that. If you stroke your dog in the evenings, typically, you'll find them doing that. So try and be more friendly with the dog, or at least check it right over for the presence of ticks. Any idea where most ticks tend to first attach onto dogs? So they're walking through the grass, so it's usually around the head and the shoulder area. That's usually where the ticks first attach. They then crawl down to the skin, and then they may migrate away from that. Just remember, you often don't see them on cats because the cats remove them much better than dogs do. But daily tick checks are incredibly beneficial. So what about people? Number 1, know whether or not the ticks are in your environment and recognize what time of the year it is. If this is January and it's freezing conditions, you're not going to come in contact with a tick. But typically, once the temperature goes above 4 or 5 degrees, they may be in your environment. Ask your local vets, ask your local public health unit what they are seeing. This is the recommendation in the textbooks, which usually goes down like a lead brick with groups like this, as in don't walk around in woods or the bush. I mean, that's the theoretical recommendation, all right? But the reality is we're going to. And I would say, please, folks, don't let ticks change your lifestyle. When I first gave this talk a few years ago in Guelph, a number of people said, well, this is the end of walking with my dog and birding. And I said, no, it's not. This is just the beginning. You've got to learn to live with them. And if you want some perspective, have a holiday in Connecticut during tick season. If you think we've got lots of ticks now, go to Connecticut. All right, there's going to be a lot more probably. But the recommendation is, ideally, when you're walking through the bush, at least wear long pants tucked into your socks or not tucked into your socks. Tucked into your socks. Why? Remind me, where are ticks going to first attach when you walk past them? Lower limbs, all right? And the reason for doing that is that's not stopping them attaching to you, but they're on your clothes, and they're then going to walk to where they can find skin. And that's usually upwards until they find the end of some clothes. Or, for instance, if you're not tucking your pants in, they walk up underneath. And they're typically walking to 3 locations where they typically attach. Sorry, folks, you need to know this. Typical places where they will attach, and I know there's exceptions, there's the scalp, the armpits, and the groin. All right, that's where they're going to attach. And the longer you can delay the attaching by wearing long pants and tucking them in, the more likely you are to find the tick before it gets onto you. I gave this talk last week, and someone sensibly said to me, why on earth are you recommending people wear long sleeve shirts? If you tell us the ticks attach lower legs. So I think it depends how adventurous you are in the environment. But if you're lying down in the grass because you're birding, all right, don't forget this can increase the risk of exposure to ticks on unusual locations. All right. What can you do to actually stop the ticks attaching to you? All right. Number one, wear long pants. And then if you apply compounds like DEET to your pants or to your skin, when you walk by, the tick literally does this. It repels the tick and it doesn't attach. DEET works well. There are a number of organic products that work pretty well when tick challenge is relatively low. There are some very strong insecticides that you can get, for instance, in Canadian Tire, but they can only be applied to your skin, to clothes and not skin, because they will cause skin irritation. And by far the most common compound is permethrin. Folks, it was identified by the US Army. Why? Because they were sending, years ago, troops into tick-infested areas, and it didn't work well during wars to have all your people infected with ticks and tick-borne diseases. So it's ironic where some of these things were identified. You can still get permethrin, it works really well, but be careful. I've put a cat with a line through it. It's incredibly toxic for cats. So if you have a cat in your household, I encourage you not to use DEET in your household. All right? And then every day after you go for a walk, check you and other family members for ticks. And I've mentioned the particular areas you'll find them. Do that every 24 hours. And something else that's incredibly helpful and sensible, shower every day. Why? Why is showering every day really helpful in respect to tick prevention? So thanks, everyone. So it's nothing to do with the water washing the ticks off, because that doesn't typically happen. But we are very good, and from personal experience, I can tell you this, we are very good at knowing where our lumps and bumps are and where our lumps and bumps are not. When I lived in East Africa, 3 times I found a fully engorged tick on me. I won't tell you where. But every time I found it in the shower. And I literally went, I don't have a mole there. And I looked, and that was correct. It was a fully engorged tick. I hadn't felt it feeding because they typically use an anesthetic. All right, so it's often not until they're well engorged that we tend to feel them. but just showering every day is a very good way of indirectly doing a tick check. But if you have concerns, in addition to that, just check each other. If they're attached, the recommendation is grab them as near as possible to the skin and pull them back slowly. If that really grosses you and you can't do it, go to your physician or your vet or your public health unit or ask a family member to help, and then take the tick to your physician. Because if it's a deer tick and there's any chance it's fed, if you see the physician, I think it's within 3 days of that tick being removed, 1 dose of an antibiotic will eliminate any risk of infection. And that works really well in people. We don't know if it works as well in dogs. So go straight to your physician with your tick and make noise. All right? So are you ready for the final exam? Will you get Lyme disease if you pull this off yourself or your dog?
No.
No, for 2 reasons.
No.
It's not the right tick. Does everyone agree? It's the American dog tick. And why is there a second no? It's not fed either. This is a great tick. Essentially. Number 2, will you get Lyme disease from this tick? Is it the right tick?
Yes.
Has it fed?
No.
So there's no risk. Now, the other day, last week, when one like this came on, by the way, the head of that tick was missing. They'd so aggressively removed it that the head was not left in the person either. But I still could identify it, all right, and it was partially fed, but only slightly. And then the person said to me, can you absolutely guarantee there is no risk of Lyme disease? And I said, well, if it's read the textbooks, there's nowhere near like 36 hours it's fed. But he said, can you guarantee? And I said, there's always exceptions in the world. Go to your physician. And they got 1 dose of doxycycline, the antibiotic. Next question. Will you get Lyme disease from this tick?
Yeah.
Definitely.
No.
Is it the right tick? Has it fed long enough?
Yes.
Is it infected? We don't know. But if you're in the Hamilton area, it's pretty likely, but particularly if you find 3 of those on you, 1 of them likely is infected. Take it as much as possible to your physician and make noise. Folks, I hope that was helpful. Hopefully this has given you some indication of how things are changing and how quickly things are changing, particularly in Eastern Ontario, but particularly also this region of Southern Ontario as well. And the risk of exposure to Lyme disease entirely depends on how you lead your lifestyle outside. There's many practical tips we've covered you can do to reduce the risk of disease. And if you're ever concerned for you or your pet, see your vet or your physician, respectively. Don't take everything to the vet or the opposite to the physician. Just like to thank these people for allowing me to share some information. I hope that was helpful. Thanks very much. Yes, in the middle. I'll try repeating the questions so people online can hear what people are asking. In the middle there.
I know a couple of people that have contracted Lyme, and some seem to be milder than others, the infections. Is there any way to predict or prevent? I mean, is it a larger dose?
So the question I think I'm being asked is, why do different people vary in the severity of Lyme disease they get? Some people never actually get sick. It's only a few. So some people are clearly resistant, and we vary in our resistance. All right, we all have different immune systems. I think there's pretty clear evidence that if you're immunosuppressed for other reasons, so you've had a bone marrow transplant, if you're on cancer management, that does increase the risk of, if you get infected, of disease developing and it potentially being more severe. It's still relatively easy to treat in the early stages of infection. So if you're ever concerned, go to your physician. But it's a very relevant practical question. Someone at the front here, yeah.
I understand that in the US, they're working on a vaccine against Lyme disease. And I became aware of that a couple of years ago from an outdoor magazine. But since then, nothing has been reported. So where are we?
We are in Canada where there's optimism. So well, I've got optimism. So the question is, the gentleman in the front said he'd heard about a human Lyme disease vaccine being developed in the US, but it's gone quiet. About 20 years ago, there used to be human Lyme disease vaccines, but it was quite clear when they were used that there were significant side effects, so they got withdrawn. I don't know what's happening in the US, but what I do know at the moment, there is a human Lyme disease vaccine trial occurring, from what I hear, in Eastern Ontario. My understanding is it's been developed by a group or groups in Quebec. So keep your fingers crossed, folks, because if that proves to be effective, it will transform, I think, all our lives. All right, so I don't know how it's progressing. I'm not surprised there's been a study in the US. I don't know why it's gone quiet. It often takes quite a long time for a human vaccine to get fully approved because they want to do all the safety studies. But it could also mean it didn't work as well as they hoped. So I don't know. So keep your eye on what's going on in Canada, particularly in Ontario. There was a question at the front, yeah.
Two questions. The first one, you showed us a map there of the progression of the problem related to climate change. And you mentioned that two factors affected, which is heat and humidity. Well, I gather the case was that you're moving away from large water sources and it should be getting drier. So both factors don't apply.
So I think I've just been accused of being too simplistic. All right. No, and that's fair. Like, you're absolutely right. Temperature and humidity are two important things. If you're in a part of North America where it's ending up getting drier, all right, then you're absolutely right. The temperature might be right, but the humidity may not be conducive for development. All the evidence is most of Ontario is going to remain pretty humid over the coming years. And we're seeing the humidity change in the prairie provinces at the moment. And that seems to be driving things. But certainly, as far as tick risk is concerned in southern parts of the US, there's clearly areas where, in fact, other ticks are probably going to disappear because it gets too dry. So move to a dry area. But it's very variable across North America, but that's a very valid point.
And the other part of the question is, I'm surprised because of the time span, which is, I think, telling us about a 30-year period. You've got a tremendous amount of knowledge. Where is this coming from?
So where's all the knowledge coming? This isn't my knowledge. This is not, sorry, I have just put together information from various people. All right, that's part of this presentation. There's a whole bunch of different groups. And can I give you one plus about living in Canada? Well, there's many. But one of them is there's a lot more research going on ticks and tick distribution across Canada and federal funding of it. And I know we curse and swear about the feds, but by comparison to federal support of tick surveillance in the US, we're doing a lot more. So I'm just trying to plug Canada. I know I curse and swear a lot about the feds. For instance, the Lone Star tick. I know the feds have got national surveillance programs going at the moment because they're concerned that's going to come in because there's another disease of humans that's associated with the Lone Star tick. So the feds are supporting this more so than they are in the US. Okay. Yes. Someone at the back.
If you have Lyme disease, does that make you immune forever and ever, or can you keep getting it?
So the question is, if you get Lyme disease once, can you get it again? I can only comment about dogs because that's my experience. And all the evidence is that dogs can get Lyme disease more than once. So the immunity that's developed typically is not protective. I don't know about people, but I'm suspicious the same is true as well. So it's the immunity we develop is not protective, particularly the more months you go out from the first incident. Lady on the left.
When we're in the backyard and we just basically are staying in our backyard, our cats in the backyard or whatever, are we just as susceptible to getting the tick as going out, or
so the
more likely in the woods, obviously, but are we still?
So the question is, if you go into the backyard, you're at risk. And the answer is entirely depends on what your backyard looks like. If it's just grass and then there's a big wooden fence, for instance, it's very unlikely the tick's going to be in that environment. But if your backyard backs on to a deciduous forest, if you've got long bush on the edge of your garden and then it progresses into a forest the other side, then yes, there is a risk. Folks, if you want some perspective, actually go to Napanee. Like a few years ago, this is Eastern Ontario, I gave a talk in Napanee I was told, it was a talk like this, I was told 40, 50 people will come out. 350 people turned out. And I did not realize how quickly things have been changing in Eastern Ontario, particularly the number of ticks. And a whole bunch of people came up to me afterwards and said, do you know, during tick season, so particularly April, May, June, we don't even let the kids in the backyard because our yards are backing onto forests. There's so many ticks. If you are in such a situation, you can do things with the edge of your yard and put a barrier between your lawn and the forest bush if you can. And then typically ticks won't establish within your lawn. You've got to have that bush associated with forests. And at the end of the day, my question to you is, what are you finding on yourself in your backyard?
Well, I did find a tiny, tiny little weedy tick.
Okay.
I freaked out about the weedy.
Yeah, and again, is that one that's established or is it one that's fallen off a wildlife species? Do you know what I mean? I don't know, but it's a very valid concern. Do you see another one in the same environment?
Haven't seen it.
So that would, if you saw that twice in 2 years, that would start making me more concerned. But if you mow your lawn regularly and get rid of bush at the end of your edge of your garden, that should reduce risk significantly. What I would say, if like me, you've been getting flyers from companies wanting to come and spray your backyard, there's many different companies will sell insecticides. They come in and spray the yard. My understanding is it works really well. Any guess what the downside is? Kills everything, including bumblebees and all the good insects in our backyard. So be careful using.
We put mulch down or something in our back garden.
The mulch, but there, mulch isn't great, but it's not perfect either.
So putting mulch down.
Mulch, it shouldn't increase the risk dramatically, but I do know a few people that have said they've seen ticks. It's not a good environment. Like you won't get large numbers of ticks associated with mulch. It's the grass and the base of the grass is where typically the humidity is best for these ticks to survive long term.
So if we put mulch down in the back section where there are some trees and bushes and stuff, mulch actually will help.
Should help, but just cut the grass as far back as possible that's adjacent to the mulch. Because then you're stopping, hopefully, the grass growing through. Yes, question over there. One more, sorry.
Has it increased the mouse population? Because it's the mice that they feed off to get the bacteria. Are there more mice around or not?
So the question is, does the mouse population drive anything? And it probably, you're absolutely right, it probably does drive a proportion of the ticks that get infected. Because the issue is Murphy's Point Provincial Park, why is the risk so much higher after a much shorter duration of having the ticks than anywhere else? And I'm suspicious there's a lot more rodents and other suitable wildlife species in that environment. That's speculation, but it's a very reasonable suggestion. Are we allowed one more?
One more, but it's a supplemental.
I'll stay around afterwards. It's a supplemental. Oh, the vet students do that. This is a supplemental, first of 5. Okay. Yeah.
The question is the white-footed mouse. Is that like a deer mouse?
I think it's slightly different in morphology. That's my understanding. I'm not 100% sure on that. No, typically not. All right.
They're not the ones we see running around in the garden.
I better be careful of that. But I mean, it infects all rodents, but that particular species is more susceptible. That's it. All right. If you've got any questions, folks, I'm more than happy to hang around afterwards. And as you go out at the back, I've put adult female and male ticks of the 2 ticks that are not fed and they're dead.